Dr. Nicholas Mercer with your Improved PT. Hip pain comes in many forms and can be caused by a variety of factors. However, in most cases of hip pain, especially when knee or back pain is also present, I usually find two weaknesses: shortened hip flexors and underactive hip extensors. Now, I don't always know what came first, the pain or the weaknesses, but I do know that restoring balance to these muscles is crucial to alleviate stress and strain on the soft tissue surrounding the hip. How do these weaknesses develop? Well, let's look at what most people have done over their lives. There's a very high chance that if you're watching this video, you spent 12 years of your childhood stuck in a chair at school. Even though for many of you, this was a very long time ago, the body remembers it and knows it can compensate for the hip extensors being so underactive by shortening the hip flexors. Add on to that the fact that you may have spent several more years studying or in class at college, and your job likely required you to sit for several hours a day. Perhaps it still does. Whatever the case may be, if you experience hip pain by itself or in combination with back or knee pain, you likely need to stretch and strengthen the hip flexors and activate the hip extensors. Fortunately, I'm going to show you one exercise that takes care of all of these problems at once. But first, let's get an idea of the actual muscles we're working on. Many muscles act as hip flexors, but we're going to be stretching and strengthening two of them specifically. So we have the iliopsoas and the rectus femoris. Now, the iliopsoas is technically two muscles. It's the iliacus and the psoas major, but they share a tendon as they cross the hips. So we can group them into one muscle for our purposes for simplicity. This muscle has connections to the top of the pelvis and to the lumbar spine and is a common cause of back and hip pain. The other hip flexor we will be working on is the rectus femoris, which is actually one of the quadriceps muscles. The quadriceps, all of these here, essentially act to straighten or extend the knee. But the rectus femoris, you'll see, crosses the hip to help with hip flexion, and that's why it's often a factor in hip and knee pain. On the back of the hip, we have the primary hip extensor, the gluteus maximus. This muscle is the main one that needs to be activated and strengthened in order to achieve proper balance in what we call the sagittal plane, which you can think kind of as the front and the back of the hips, which are responsible for hip flexion and extension, respectively. Do you have to remember all of this? Absolutely not. All you need to do is follow along with this exercise. Let's get started. So, as always, if you are getting sharp pain or anything with this exercise is irritating you outside of basic muscle fatigue, muscle burning, like it's getting tired, or soreness, you definitely want to go see your physician. But ideally, you should feel better. Your pain should feel better after you activate the glutes and basically do this exercise, right? So you're going to want to have something soft for your knee here, all right? So first thing you're going to do, and this is going to look like a basic hip flexor stretch to start out, okay? So we're in this position, and the first thing we want to do is don't think about bringing the hips forward like this, right? Because I can compensate and go all the way forward like this. It's just my back is arching, right? I don't care how far forward you get. I don't care how flexible you look. What I care about is that you're feeling a stretch through those hip flexors, right? And tightness and squeezing through your butt, okay? So what you're going to think about is the knees pushing down to the ground. The top of the head is going towards the ceiling. You're pulling the belly button in. Okay, just by doing that, you may already feel the glute tighten up. If not, squeeze the glute here and try to push the hip forward as you come up, right? So you should feel a stretch to the front and tightness to the back here, okay? So this is mainly stretching the iliopsoas, not so much the rectus femoris unless it's really, really restricted. So what we're going to do, this is kind of just the first part. So we're going to hang out here a little bit, get a little bit of a stretch to the iliopsoas, right? Get some tightness through that glute there. But then we need to make sure that we can start to work on the rectus femoris as well. So what you're going to do, I have a yoga block, but you can use whatever you want to as an elevation. And you're going to put that right where your foot was, right? So you're going to elevate the foot a little bit. Okay, then same position. Again, we're not thinking about going forward as far as possible. We're thinking about the spine, going up, pulling the belly button in, okay? So if your rectus femoris is really, really tight or really, really restricted, you'll start to feel this a little more through the quad here, right? I'm feeling it a little bit more, but my hip flexors are pretty flexible. So squeezing the back of the hip, we're getting some activation there, squeezing really, really hard, feeling that stretch in the front of the hip. And you can do this in a few ways. You can do kind of a low grade activation through the butt, get that stretch through the front of the hip and hold it for longer, like 20 to 30 seconds, or you can squeeze really hard for 5 and then relax. Squeeze really hard for 5 seconds and then relax, right? Keeping that belly button pulled in the whole time. Now, this is where the fun part comes in and where you're probably going to be sore. To start to actually strengthen the hip flexors in this lengthened position, we have to add some resistance, right? In this case, the resistance is going to be the ground or the yoga block or whatever is under your foot. So I got my booty squeeze. We're getting some activation through the butt. You're getting a little stretch through here, maybe a little bit through the rectus femoris. And holding the belly button in, you're going to push your foot down into the yoga block, and you should feel your quads, your rectus femoris, and maybe even your hip flexors light up as they're stretching, but also being activated in this position. Right, hold 5 seconds and then relax everything. Pull belly button in, squeeze the glute, push down to the yoga block, feel that stretch through here, that activation through here. 5 seconds and relax. Now, over time, as you get more comfortable with this, doing like sets of 5 to 10, I'm not really worried about the number. I'm worried about what you feel. Do you feel like all of this is kind of getting tired? Is it stretching? Are you feeling better after you're doing it? Does it feel like it's opening up? Does this feel like it's controlling your hip a little better? Typically, sets of like 5 to 10, depending on where you're at, is going to be that sweet spot. Now, if you're using a yoga block, in order to progress this, you just make it a little higher. You pop the foot up, so now the foot's a little higher. You're going to feel it a little more through here. If you're feeling it more through your knee, you may need to just get more cushion under your knee. If you put more cushion, like a pillow under your knee, and you're still feeling it in your knee, you want to back off on the foot, right? You want to bring that lower. If that's still bothering you, just go to the floor and focus on this, right? But the ideally, over time, as you get better at this and you practice and you get more flexible and you get more stable and you're feeling better, you can have something like a wall or a door to hold on to, and you want to grab this foot and be able to do this, right? So butt is still squeezed, belly button's still pulled in, right? I'm not trying to go as far forward as possible. I'm just trying to get up nice and tall. And now we're going to squeeze the glute. Once you squeeze the glute, you should feel that stretch there. And then I'm going to push into my hand just for 5 seconds, then relax, and then we're just going to try to pull it a little more. All right? You can keep that glute squeeze the whole time here too. All right? And push down. 1, 2, 3, 4, 5. Relax, try to pull it a little more. As you get more comfortable, you can do both hands. All right? Squeeze the glute. Ooh, that's a good stretch. And then push down. 2, 3, 4, 5, and relax. Okay? How much you do, how long you hold, how often you do it is going to depend on you and how you're feeling. If your hip pain, the symptoms that you're doing this exercise for, gets worse with this exercise, this is not the exercise for you. Most people, though, they typically just feel that the muscle gets tired, the muscle gets fatigued, the muscle gets a really, really good stretch, and they may be sore for a little bit. That's okay. If you do get sore, just make sure that you're resting a little bit, right? Don't go all out with the pushing down into the yoga block or pushing into your hand or squeezing the glute, but we still want to get kind of a light activation until that soreness clears up. So that is a great way to not only help activate the glute max, the hip extensors, but to help balance out the hip extensors with the hip flexors. So it allows you to stretch the hip flexors, but also strengthen and activate them in that stretched position so they know how to balance your hip. Of course, hip pain is complex, and you likely have some other problems in addition to hip flexor restrictions and weak glutes. And integrating this new strength and flexibility into functional movements can be hard to do without proper guidance. That's why I made a free app for people just like you who suffer from hip pain. Download the You Improve PT app by clicking the link in the description below and try one of our pain relief programs absolutely free. Also, make sure you like this video and subscribe to the channel so you never miss a video on living life without pain. And as always, leave a comment below with your hip pain story. Thanks for watching.